following is a production of West Virginia Public Broadcasting.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University. Welcome to Doctors on Call. Tonight's topic, skin problems. Two experts are here to answer your questions. Now here's your host, Dr. Joe Prudhomme.
Good evening. It's the end of July, but there's still lots of summer left. Lots of time to continue abusing your skin. And we're clearly seeing and showing a lot more of it these days. But exposure to the elements, as well as the regular ravages of time, take their toll. Have you heard the latest about tanning beds? What can you do to prevent and erase wrinkles? What are the warning signs of skin cancer? We'll get the answers to those questions and more tonight from our two guests. Dr. Roxanne Powers, a dermatologist at WVU, whose specialty interests include screening and prevention, and Dr. Tony Van Norman, who's also a WVU dermatologist. If you'd like to ask our guests a question, please give us a call. Our phone lines are open now. Roxanne, I'm curious. I saw it in the paper today and it's all over the news. Supposedly it shows us once and for all that tanning beds are as bad as the sun. Are they right?
Well, yes, and we've actually thought that for a long time, but it's been hard to convince, especially young women, that that's true. It's become fashionable in this country to be tan, and there's also some evidence that there's something addictive about lying in a tanning bed. It's soothing, and people like the feeling they get, but it comes with a huge price. You get the same damage to your skin that you get from the sun. There has been a report of a marked increase in melanoma skin cancer, the bad type of skin cancer, in young women especially, and it's thought to be directly related to tanning bed use, which probably contributed to the International Cancer Research Group labeling tanning beds as a significant carcinogen, which is what this report came out about. Apparently in Great Britain, there's also been a great increase in the number of young women who are developing melanomas, and it's thought to be associated with this for sure.
So no excuses. It's not good for anybody. I can tell them all no.
No.
All
Hard
right.
to convince them of that, but it's just not the way to go.
So Tony, if I want to look good and have that tan look without being bad for myself, what can I do?
I think there's some really good and proven to be safe options with artificial tanners that you can buy over the counter in places like your local Rite Aid, Walmart, pharmacy. There are even some of the same vendors that have the tanning beds now that to augment their offerings maybe in a safer fashion, you can go in and have a tan just sprayed on. And the chemical that they use has been around for a number of years now, and it seems to be a safe alternative to maybe get that summertime color that you're looking for without, damaging the skin in the process.
So spray tans are okay. That's good to know.
Seems that way.
Excellent, excellent. So if I've tanned too much and I was a bad boy, what are the warning signs of skin cancer I have to worry about?
I think the big thing as far as self-home exam and preventative maintenance is really to look at yourself frequently at home. You're looking for moles that are changing, that are asymmetric or have some border irregularity, a change in color, a darkening in color, an increase in diameter. And what I really like to tell my patients is to really keep it simple and look for things that appear to be outliers, that just don't match up with the rest of the background moles that you may have. I think that's a good place to start.
Okay. So Roxanne, I've had a skin cancer before, and now I'm worried I'm going to get another one. How often should I come see you to get a checkup?
Well, you're right about that. Any history of skin cancer increases your risk for developing another type of skin cancer. There's also some reports of a history of skin cancer being associated with other types of malignancies, so you do want to be more vigilant. We usually see people who've had a skin cancer about every 6 months. Sometimes they drop back to once a year, but at least a yearly check. That is only to supplement looking at yourself once a month. We recommend that patients stand in front of a mirror and get used to what they see on their skin so that they can notice any change that's occurred. So probably the first of every month, everybody should look, and then they should go see their doctor either once or twice a year.
Once or twice a year, great. I understand we have a caller on the line. Eva from Belmont County, Ohio. Eva, have you got a question for us?
Yes. I would like to know, every year it starts around, I would say, May, and it lasts until October. I get this, it's in my lower leg, a big red rash. I went to the dermatologist. One time he told me it was eczema. The next time, about 2 years ago, he told me it was ringworm. Then a couple days ago, he said it was ringworm. And I'm thinking, why am I getting this? It's a fungus, and I just don't understand.
Who wants to take that one?
I'd like to know if she's taking blood pressure medicine.
Yes, I'm taking HCTZ.
Well, that's what I was looking for, because HCTZ, hydrochlorothiazide, can be associated with a sun sensitivity rash, which would explain why you only get it in the summer months. A lot of patients will go out into the sun that are on hydrochlorothiazide, and the sun interacts with the medication and can give you an itchy, reddish, sometimes bluish discoloration. So that's one possibility. There are a number of other medications that have photosensitivity associated with them. So that'd be one thing I'd think about doing, talking to your doctor about changing medication during the summer months or when you're going to be sun exposed in case that's the cause of it.
Is tetracycline another common one that does that too?
Yes, tetracycline has a lot of sun sensitivity. Some of the nonsteroidals can be associated with sun sensitivity. There's a lot of them. So if you find that you get a sun-sensitive rash in the summertime, start to look at your medications to see if you can find a cause.
I think we have another caller with a question. Kay from Boys County, Kentucky. Kay, would you like to ask us a question? Go ahead, please.
Thank you. My husband is getting white spots on his hands, and it started out minor. Now it's pretty major, and it's going up his arm. And we wanted to know what we could do for that.
Tony, you want to take a try?
Sure. When did this process start with your husband?
Approximately a year and a half ago.
And it's extending slowly?
Yes.
It sounds like he may have a disease of the skin that's called vitiligo. And this is a process where the body slowly starts to attack the pigment-producing cells in the skin. The hands and the feet are places that it likes to start out. It tends to move along in sort of a symmetric fashion, attacking each side in the same way. It's typically slow-moving. Does your husband have any other health problems?
She's gone. I'm sorry, that caller is gone. Just listen to your answer, though. And if you have another question about that, please check back with us afterwards. We have a call now from Bobby from Putnam County. Bobby, please go ahead.
Hey, how you doing?
Good.
I recently relocated up here to West Virginia. I have a family history of psoriasis. Since I've moved up here, I have broke out. On my legs, arms, back, well, pretty much everywhere, but I've got it on, not got it on my face yet. You were talking about the tanning bed. My sister, she does do that. My dad does it to keep it down. They say that helps. Also, I went to the doctor, and they put me on this lotion to put on twice a day. I can't even pronounce it, but I put it on twice a day. It has not helped. It's still spreading. I don't know why all of a sudden I broke out with this and you know, breaking out a lot. It's coming on to my skin. I'm sorry, I'm nervous, but I mean, how do I get rid of this? How do I control it without going to the tanning bed? I know the dangers of that, and I don't want my wrinkled skin and stuff, but I want to be able to control this down some. It itches like crazy. It's flaky, you know, flaking all over your skin. What else is there to do?
So Bobby's got psoriasis, which is getting suddenly worse. What should we be concerned about?
Well, psoriasis is like that. It'll come and go. Sometimes you'll go through worse periods and it'll improve. We usually start out with topical therapy, and if it gets to be too extensive, like it sounds to be with her, that gets harder to use, but a topical mid-potency steroid is often helpful, and sometimes we'll alternate that with another medication to reduce the steroid effects. Light therapy, she mentioned, can be helpful. We use that in a very small amount, and she's right, it does increase your risk down the road for skin cancer, so it has a price associated with it, but occasionally you can do that for a while just to ease things up. Then you can move on to oral medications. Those medications generally have some potential side effects. One of them that comes to mind is methotrexate, which is a chemotherapeutic drug, but it's pretty well tolerated if it's monitored. We do tend to avoid it in people with liver disease. And then there's another medication, Seritane. Again, you have to keep an eye on the liver and keep an eye on their lipids and triglycerides. And it's not a good drug for young women, but women that are beyond having children, that would be a useful medication. And then you can move on to the very expensive new biologic drugs that you've heard about. Probably there was a lot of advertisement when they first came out, but they're extremely expensive. And they do suppress your immune system, so they don't come without a price either, and you have to be monitored and be very careful about infections. But they can be very effective in reducing the outbreaks.
Great. So Bobby, we do have some more options for you. It sounds like there are at least 2 or 3 more things to try. So maybe you should get back with your doctor and let him know that it's still getting worse. We've got another call from Kanawha County. We have Lee on the line. Lee, please ask your question for us.
My question is you, sir. Hello?
Yes, please, go ahead.
Can you hear me all right?
Perfectly.
My question, I've got a case of Kaposi sarcoma cancer. I've had it for about 10 years. And the Mayo Clinic had a prescription to radiate my legs and take chemotherapy. Well, the radiation done me in because it burned my whole legs. But my question is to you, sir, I can't walk, and I'll tell you, I'm 94 years old. I still got my senses. I hope maybe I could live another couple of years without any pain. But the bottom of my feet, especially the right foot, the bottom is so painful, I can't walk. Is anything you could do, or you know of what to do for me to get the medication so I could be able to. I'm taking chemotherapy by mouth, and then also I'm taking a Percocet medication for the pain. But that Percocet hasn't helped me too much because I take 2 every 4 hours, and it hasn't helped me because I have to dribble when I'm walking. I thought maybe you have some sort of medication I could take or send me somewhere.
All right. Well, thanks for that question, Lee. Tony, do you guys treat Kaposi sarcoma, the skin cancer? It's actually a vascular cancer, isn't it?
Exactly. It's usually a diagnosis that's treated in combination, with our oncologist, the dermatology clinic, and in his case, in more extensive cases, radiation oncology may or may not play a role. I wonder if he's having difficulty walking and with pain secondary to ulceration and that sort of thing, and he may even benefit from being set up with a wound care specialist if that is the underlying problem and is responsible for his pain.
So that wouldn't be something that a dermatologist would typically tackle by themselves, and that's
It might be a nice starting point in that therapy may be modified, or there could be some type of care arranged through another physician or something like that to try to help ameliorate the pain.
Well, Lee, I hope that you find some good luck. It sounds like your dermatologist may be able to help you some with this, but it's several kinds of specialists that you need to be seeing. And so good luck with that. We have Pam on the line from Monongalia County. Pam, do you have a question for us that we could answer?
Yes, I hope so. Last August, I was diagnosed with Rocky Mountain spotted fever, and after going to various doctors and dermatologists, and I've never gotten rid of my spots. I still have them on my arms and legs, and they say that it destroys the capillaries. And I was just wondering, will they ever heal, and will the spots ever go completely away, and can I ever get this again?
Roxanne, do you know anything about Rocky Mountain spotted fever?
Well, I haven't seen the spots last, but I guess if there was enough of a vasculitis in the vessels that she could have some what we call post-inflammatory hyperpigmentation, which just is a fancy way of saying anytime you have a reactive area, it often takes a while for it to resolve. So the hyperpigmented areas will probably gradually fade, but it may take a very long time. I would continue to moisturize regularly and do everything I can to keep my skin healthy. Now, in terms of getting Rocky Mountain spotted fever again, I would guess if she's exposed to a tick again, that's always a possibility. But it's usually related to a tick bite.
So not likely to come back on its own. Interesting question. We have Anna on the line from Fayette County, West Virginia. Anna, what's your question for us tonight? Go ahead, please.
Hello. My husband has had a rash on his butt for about 20 years, and it will not go away. He's went to a dermatologist. They've taken biopsies, and he's been prescribed everything. I've used everything over the counter for yeast infections, poison ivy, ringworm, antifungal, hydrocortisone, any itch. He has water running out of his butt, itching him all the time and sore. He can't hardly sit up. And it gets worse from time to time. And it'll dry up and clear up and think, well, it's going to go away. And then it's back again. And the medicines, it seems that it gets immune to the medicines. It just, it'll seem to clear up for maybe a couple of weeks, and then it's right back again with something new, some new medicine. What in the world can he do? They prescribed, dermatologist said it was acne, and it don't make sense. Just don't make sense. We've put jock itch medicine on to everything.
Sounds like a frustrating problem. 20
yes,
years.
Sir.
Have any ideas for Anna?
That sounds like a tough case. You know, a couple of things come to mind. Some people suffer for long periods of time with a disease just simply called folliculitis, which is simply an inflammation around a hair follicle that can be rather chronic and affect some people and not others. It can be infectious in cause. It can be secondary to constant friction. People that sweat a lot may have problems in that regard, and it can kind of come and go in response to therapy at times, but can come back. Another thing that comes to mind, I recently had a case that was pretty similar, and the patient had been exposed to baby wipes. They had been using baby wipes in the place of typical toilet paper, and they were allergic to some of the chemical compounds in the baby wipes, and that would present with a pretty chronic red, itchy rash in that part of the body, so that may be something to think about too.
Any role for a biopsy in that sort of a scenario where something's been going on 20 years?
Most definitely. The biopsy could be helpful to kind of separate out the different potential problems and causes. It may be non-specific, but it definitely could help out in trying to find the problem and treat it appropriately.
Thanks. All right, the next caller is Barbara from Monongalia County. Barbara, we're ready for your question. Go ahead, please.
Yes, my husband he retired in 2005, and he likes to sit in the sun on the porch, and he sits there every summer since he retired. That's mostly his hobby, is sitting on the porch and, planting his garden. And recently, this year, though, he has developed a rash on his back, it looks like the rest of the skin is real tan, but this looks like little white spots. And under his arm, and my son had a fungus, and they told him to use the Selsun Blue, but his was a fungus, and his went away, and he told his dad, this is a fungus. Well, he's been using the Selsun Blue, but it seems like it's gotten a little bit better, but the white dots, patches are still on his back.
All right. Roxanne, white spots on the back, what could that be?
It does sound like it's what his son has, which they call it Malassezia furfur. It's a yeast infection. It's very common, and it appears that some people get it and others don't. And a husband and wife, one may have it, one may not. And if you're sensitive to getting it, it's very hard to get rid of it. The Selsun Blue helps to keep it at bay, and we always tell people to use that to bathe at least twice a week to try to suppress the growth. But sometimes if it's bad enough or bothersome enough, we'll use an oral antifungal agent, and that'll often clear it up. It's one of those medications you have to take and then exercise to induce a sweat, because the medication's excreted in the sweat, and then you don't bathe for 8 hours to kill off the yeast, and usually that gives you good results, but it'll often come back if you don't keep using the Selsun Blue. The good news is it doesn't usually have symptoms, so you really don't have to treat it if it doesn't bother you, but a lot of people don't like it because of the discoloration of the skin.
Fascinating. Excellent. All right, next question is from Donna. Donna in Marion County. Ask us what you'd like, Donna.
Okay, you were talking about, watching your moles, if they change and have any discoloration in any of them. Does that also go for sunspots or age spots also?
Yes, especially on the face. There's some...
It's on the leg, because I've had one, but it seems to keep getting bigger. And a while back I had it biopsied, but they said it was okay. But it seems to keep getting a little bit bigger, and it's almost like right now like the size of a dime, starting to be like the size of a dime. But it really has like 3 different colors in it. Like one part of it will be like a light color, and then there'll be a darker color, and then on one side of it, it's darker than the rest of it. Well, and it is kind of raised just a little bit where the darker part is.
If you're concerned, probably the best thing to do is be checked, because there are some very benign lesions that can do this called seborrheic keratoses that we all get more of as we get older, and they can look pretty nasty and brown, and oftentimes people come in concerned about them. They look a little bit like they would flake off. They sit right on top of the skin, which is one way we help identify them. But there is a form of melanoma that occurs in older people called lentigo maligna, and it can just be a flat, slowly growing plaque that gets larger and darker over time. And that's the one I was mentioning is more often on the face. But anything that's changing needs to be checked to be sure.
So even though she's had it checked, it sounds like that's due for a recheck. Our next call is Edward from Wyoming County. Edward, tell us your question, please.
My wife has this sort of like, it's not scaly, red spot on her head, and it comes on and then it's there, and then her hair starts losing from the spots. She's lost quite a bit of hair over it. She went to a dermatologist, and they have given her biopsies, and they've also taken, what do you call them things? Cortisone shots, and also, one of them biopsies. I was wondering what could she do about it, and what's the problem, But she's lost quite a bit of hair on account of that.
Hair loss and a red spot. Tony, what do we do?
If she responded well to the steroid shots, there may be some thought that she just has a chronic, long-standing inflammatory process in the scalp, and that can be a very difficult thing to treat and get a long-lasting response to. The other idea that I would keep in mind is if it did not seem to be particularly responsive to these steroid shots, you never want to forget about the potential for a skin cancer to show up on the scalp, because that's an area that can also make skin cancer. So I would probably, again, have the area looked at by a local dermatologist to keep check on it and to make sure that it's better controlled.
Okay. Roxanne, we only have just a few seconds left, but how often should you visit the dermatologist if you're not having a problem? I'm a redhead, my kid's a redhead. What's the routine screening for dermatology?
Well, probably yearly would be a good idea. That being said, if it's somebody who has no problems at all with their skin, they probably don't have to. But if there's any question, if you have a family history, fair complexion,
excellent,
I would go in.
All right. Well, thank you very much. We've been talking about skin problems with Drs. Roxanne Powers and Dr. Tony Norman. Thank you both for being with us. If you'd like more information, see your family doctor or visit our website at wvuhealth.com. For Doctors on Call, I'm Dr. Joe Prudhomme. Good night and good health.
Join us again next week for another edition of Doctors on Call. Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
This has been a production of West Virginia Public Broadcasting.